If you're over 50 and you've been reaching for ibuprofen, naproxen, or any painkiller just to get through your day, I need you to stop what you're doing and watch this video to the end. Because what I'm about to share with you isn't a trend, it isn't a supplement ad, and it isn't something your doctor probably told you about during your last 10-minute appointment. There is a spice, sitting in most people's kitchens right now, that has been shown in peer-reviewed clinical studies to reduce joint inflammation, protect cartilage tissue, and significantly reduce chronic pain in as little as 30 days. And the most important part? Unlike the pills most seniors take every single day, it doesn't slowly destroy your stomach, your liver, or your kidneys in the process. My name is Dr. Victor Harlow, and today, we're going to talk about what's really happening inside your joints after 50, and the natural solution that the research says works. Let me start by saying something that most health channels won't say out loud. Joint pain after 60 is not just part of getting older. In that phrase, "it's just your age," has been repeated so many times that millions of seniors have simply accepted daily pain as their new normal. They wake up stiff. They struggle to stand from a chair. They avoid walking the dog, climbing stairs, or playing with their grandchildren, not because they want to, but because every movement sends a sharp reminder that something inside their body is breaking down. According to the CDC, over 58 million adults in the United States have been diagnosed with some form of arthritis. And that number doesn't even include the millions more living with undiagnosed joint deterioration. The most common form, osteoarthritis, occurs when the cartilage that cushions your joints begins to wear away. And once it starts, most people are told there's very little they can do. So they reach for a pill, and then another, until the pills become as routine as breakfast. But here's what most people are never told about that routine. NSAIDs, non-steroidal anti-inflammatory drugs, are the most commonly used pain medications in the world. Ibuprofen, naproxen, aspirin, diclofenac. Millions of seniors take them daily. Many take them multiple times a day. And yes, they reduce pain temporarily. That part is real. But here is what the research also shows. A landmark study published in the journal Osteoarthritis and Cartilage found that long-term NSAID use may actually accelerate cartilage loss in knee osteoarthritis patients. Let me say that again. The very pills being taken to manage joint pain may be speeding up the destruction of the joint tissue, causing that pain. Beyond the joints themselves, long-term NSAID use is directly linked to gastrointestinal bleeding, kidney damage, elevated blood pressure, and increased cardiovascular risk. The American Journal of Medicine estimates that NSAID-related gastrointestinal complications result in over 100,000 hospitalizations every single year in the United States alone, and the patients most at risk: adults over 60. Now, I'm not telling you to stop your medication without speaking to your doctor. That is not what this video is. What I'm telling you is this: there is a conversation worth having, a different option worth knowing about, and a body of scientific research that most people sitting in pain right now have never been shown. So let's talk about what your joints actually need to heal. To understand why this spice works, you first need to understand what's happening inside a deteriorating joint. Cartilage is the firm, rubbery tissue that covers the ends of your bones where they meet at a joint. It acts as a shock absorber, a cushion, a gliding surface that allows smooth, pain-free movement. Unlike most tissues in your body, cartilage has no blood supply of its own. It receives its nutrients through a process called diffusion, meaning it depends entirely on the fluid surrounding it to stay healthy. As we age, three things begin to happen that accelerate cartilage breakdown. First, chronic low-grade inflammation. The joints become a constant battlefield of inflammatory molecules called cytokines. These cytokines, particularly ones called IL-1 beta and TNF-alpha, directly trigger cartilage-degrading enzymes inside the joint. Second, oxidative stress. Free radicals accumulate in joint tissue and attack the collagen matrix that gives cartilage its structure and strength. Third, reduced collagen synthesis. After 50, your body produces significantly less type 2 collagen, the specific protein that cartilage is made from. Less collagen production means slower repair, and slower repair means the damage compounds year after year. So what does cartilage need to stop this cycle? It needs a compound that can do three things simultaneously: reduce that deep inflammatory response at the cellular level, neutralize oxidative damage in joint tissue, and stimulate the body's own collagen repair mechanisms. For decades, scientists searched for a pharmaceutical solution, but one of the most compelling answers was already sitting on your kitchen shelf. The spice is turmeric. More specifically, a compound found inside turmeric called curcumin. Now, before you click away thinking you've heard this before, I want you to stay with me, because what most people know about turmeric is only a fraction of what the science actually shows. Turmeric has been used in Ayurvedic and traditional Chinese medicine for over 4,000 years, but it wasn't until the last 2 decades that modern clinical research began to catch up with what ancient practitioners already understood. Here is what the peer-reviewed literature actually says. A randomized controlled trial published in the Journal of Medicinal Food compared curcumin supplementation directly against ibuprofen in patients with knee osteoarthritis. The result? Curcumin performed equally as well as ibuprofen in reducing pain and improving function, with significantly fewer gastrointestinal side effects. A 2021 systematic review, published in BMC Musculoskeletal Disorders, analyzed 10 clinical trials involving curcumin and joint health. The conclusion was clear. Curcumin significantly reduced pain scores and improved physical function in osteoarthritis patients. And a study published in Phytotherapy Research found that curcumin directly suppressed the inflammatory cytokines IL-1 beta and TNF-alpha, the exact molecules responsible for triggering cartilage-degrading enzymes inside your joints. This isn't folk medicine anymore. This is clinical science. But here's the part most people miss, and it completely changes how effective this spice actually is. Curcumin has one significant challenge, and understanding it is the difference between this working for you and doing nothing at all. Raw turmeric powder has very poor bioavailability. That means when you simply sprinkle it on your food or drink it in warm water, your body absorbs very little of the active curcumin compound before it's metabolized and eliminated. This is why some people try turmeric and feel no difference. It's not that it doesn't work, it's that they're not absorbing it properly. Here's how to fix that, and it involves something else already in your kitchen: black pepper. Black pepper contains a compound called piperine, and piperine has been shown in clinical research to increase the bioavailability of curcumin by up to 2,000%. 2,000%. That single addition transforms turmeric from a mildly helpful food ingredient into a genuinely therapeutic compound that can reach your joint tissue in meaningful concentrations. Now let's talk about what happens once it gets there. Inside your joints, curcumin works through several mechanisms simultaneously. Mechanism 1, NF-κB inhibition. NF-κB is a protein complex that acts like a master switch for inflammation in your body. When activated, it triggers the cascade of inflammatory molecules that destroy cartilage. Curcumin has been shown to directly block NF-κB activation, essentially turning off the inflammation signal at the source. Mechanism 2, COX-2 suppression. COX-2 is the same enzyme that ibuprofen targets. Curcumin suppresses COX-2 activity naturally, reducing pain and swelling without the gastrointestinal damage associated with pharmaceutical COX-2 inhibitors. Mechanism 3, antioxidant protection. Curcumin is one of the most potent natural antioxidants identified in clinical research. Inside joint tissue, it neutralizes the free radicals responsible for collagen degradation, protecting the structural integrity of your cartilage over time. Mechanism 4, collagen stimulation. Emerging research suggests curcumin may actually upregulate type 2 collagen synthesis, meaning it doesn't just slow the breakdown, it may actively support the rebuilding process. This is why the 30-day window matters. Joint tissue doesn't change overnight. But with consistent, properly absorbed curcumin, the research shows measurable improvements in pain, stiffness, and mobility within 4 to 8 weeks of daily use. Now let me give you the exact protocol. Here's what the research supports as an effective daily protocol for joint health. Step 1. Dosage. Clinical studies showing significant joint benefits have generally used between 500 and 1,000 milligrams of curcumin per day. This is roughly equivalent to 1 full teaspoon of high-quality turmeric powder, taken consistently every day. Step 2. The black pepper rule. Always combine your turmeric with a small pinch of black pepper. Even 1/4 teaspoon is sufficient to activate piperine and dramatically increase absorption. This is non-negotiable if you want results. Step 3. Fat-soluble delivery. Curcumin is fat-soluble, meaning it absorbs far more effectively when consumed with a healthy fat. A small amount of olive oil, coconut oil, or even full-fat yogurt alongside your turmeric dramatically improves how much reaches your bloodstream and joint tissue. Step 4. Timing. Take your turmeric with a meal, not on an empty stomach. This optimizes absorption and prevents any mild digestive discomfort some people experience when beginning. Step 5. The golden milk method. One of the most effective and enjoyable ways to consume this daily is through what's traditionally called golden milk. Warm 1 cup of whole milk or unsweetened oat milk. Stir in 1 teaspoon of turmeric, a pinch of black pepper, a small amount of coconut oil, and optionally a touch of honey for taste. Drink this each evening before bed, allowing your body to absorb it during overnight rest and repair. Step 6. Consistency over intensity. This protocol works through consistent daily accumulation, not through large occasional doses. Missing days resets the anti-inflammatory process. 30 days of uninterrupted daily use is the minimum threshold the research points to for meaningful improvement. Week 1. Your body begins to reduce systemic inflammatory markers. Week 2. Many people notice reduced morning stiffness. Week 3. Mobility improvements begin to emerge. Week 4. Pain reduction becomes measurable and consistent. Hey, third, let's talk about what to pair with this protocol to maximize your results. Turmeric works best as part of a broader anti-inflammatory approach. And there are several foods that work synergistically with curcumin to protect and rebuild your joint tissue. Fatty fish, salmon, sardines, and mackerel are rich in omega-3 fatty acids, specifically EPA and DHA, which have been shown in multiple clinical trials to reduce joint inflammation and improve mobility in arthritis patients. Aim for at least 2 servings per week. Bone broth, rich in type 2 collagen, glycine, and proline, the exact building blocks your cartilage needs to repair itself. A daily cup of bone broth alongside your turmeric protocol creates a powerful joint rebuilding combination. Ginger, a close botanical relative of turmeric, ginger contains compounds called gingerols that independently suppress the same inflammatory pathways as curcumin. Adding fresh ginger to your diet amplifies the anti-inflammatory effect significantly. Vitamin C-rich foods, oranges, bell peppers, and strawberries provide the vitamin C your body requires to synthesize collagen. Without adequate vitamin C, collagen production stalls regardless of how much curcumin you consume. And finally, water. Cartilage is approximately 80% water. Chronic mild dehydration, which is extremely common in adults over 60, directly impairs the cushioning ability of cartilage and accelerates wear. 8 glasses of water daily is not optional. It is foundational joint care. These foods don't replace the turmeric protocol, they complete it. Here is what I want you to take away from this video. Joint pain after 60 is not a life sentence. The idea that your only option is a pill that temporarily masks the pain while potentially accelerating the damage underneath, that idea deserves to be challenged. The research on curcumin is not fringe science. It has been published in peer-reviewed journals, tested in randomized controlled trials, and studied across thousands of patients. It is not a miracle. It will not reverse severe end-stage joint disease overnight, and it is not a replacement for working with your physician. But for millions of seniors living with daily joint pain, it represents something genuinely important. A natural evidence-based option that addresses the root cause of joint inflammation rather than simply silencing the signal. Start the protocol tonight. Be consistent. Give your body 30 days. And before you go, if this video gave you something useful today, something your doctor didn't have time to tell you, please consider subscribing to this channel. Every week I bring you science-backed health education designed specifically for your body, your age, and your life. Because you deserve more than a 10-minute appointment and a prescription pad. I'm Dr. Victor Harlow. Stay strong. Stay informed.